My name is Jennifer Stone. I'm a psychiatric nurse practitioner who just started at LÉVO. I am relatively new out of school. I graduated about a year ago prior to relocating to Utah. I'm from Massachusetts. I went to Massachusetts College of Pharmacy and Health Sciences and got my master's to become a psychiatric nurse practitioner.
What fuels your passion for helping patients through mental health concerns?
I became a psychiatric nurse practitioner. In general, the reason that led me into nursing to become a registered nurse is my desire to I like to help people. I like to help them feel better, both physically and mentally. And then I decided to continue my education based on my experiences. I have some personal experiences with my son and raising him and the challenges of, youth experiencing mental health issues, and then the sort of experiences of parents and how hard it is to kind of find resources for kids. And I think a lot of times parents don't know where to go or what to do, and they feel alone. So that sort of made me decide to become a psychiatric nurse practitioner and use sort of my experience in care that was lacking or resources that I couldn't find to be able to connect people to those things.
Are there any populations specifically that you're passionate about working with, like age group, demographic?
Uh, as far as populations that I'm interested in or more passionate about, I am a newer provider, so I guess my passion does come from my experiences with my son. So I enjoy the adolescent young adult population, but I also I have a passion for helping parents, supporting them through their issues in raising children who have mental health issues, because that is really hard. So I think I enjoy all populations for the most part, but like I said, I do have a place in my heart for the kids and the young adults and their parents.
Why would you say a medication evaluation is something important for a patient to consider?
A medication evaluation for psychiatric medications is an important piece, especially to have that done by somebody who specializes in psychiatry, because we can, perform an in-depth assessment, make a diagnosis, and then sort of come up with a treatment plan to address not only, if you have anxiety, depression, or anything like that, but sort of the psychosocial aspects of your life, what's going on with work and at home and your family situation, and kind of come up with a plan to address all of those things in addition to the medication.
Are there any myths or stigmas about medication, specifically maybe mental health medication, that you want to kind of dispel or talk about?
I think a common myth is that, like medication, if you take it, that's it, you'll be good, and there isn't really anything else you need to do. But, in reality, it can be very helpful and can definitely be used with other tools. Therapy is really important, and taking care of, sort of other aspects in your life.
Aside from medication, what other tools or strategies would you recommend to a patient who might come see you?
Um, Medication is a very useful tool, but one that really can only do so much benefit. And without using additional resources and tools, you won't get the full benefit of your medication. So therapy is really helpful, and we definitely recommend that. And in addition to that, you sort of have to take care of your physical health as well, because they sort of work together. So that, includes like exercise, which is really helpful, getting outside, being in the sun, and then taking care of, like following up with your primary care doctor and taking care of your routine physical health is also going to be very helpful to you.
For those who are thinking about coming to LÉVO for the first time, could you walk them through maybe what a first appointment or like the first time meeting with you, what that would look like?
Okay. An initial appointment with me would basically be me getting to know you. I would sort of guide you to try to find out specific things, but mostly, what brought you here today? What changed in your life that made you take the leap to reach out to a provider? Because that is a huge first step and can really be a challenge. And then throughout the interview, I want to get to know you and your story, what brought you here, and sort of the other aspects of your life that affect your mental health, about your family and your work and what you like to do.
On that same note, is there a specific way you like to connect with your patients or maybe make them feel comfortable?
I think connecting with patients is really important for the patient and the provider. And I think to be able to do that, being open as much as you can as the provider, but actually, truly listening to a patient and letting them tell you their story, and maybe connecting on a level with shared experience.
What do you do to maintain your own mental health?
So, as a provider, it is really important to maintain your own mental health. And I do a couple different things. I love to be outside and I love to hike and just sort of experience Utah and all of its different beauty. I also like to spend a lot of time with my nephew, who's almost 2, who is amazing and pure joy. And that is absolutely great for my mental health personally. And then I try to take care of my physical health. I do all my screenings and my follow-ups and yeah, take care of all different aspects of my life and find other activities that I enjoy to do. I like to see movies and also do like to just, binge TV shows and that sort of thing also.
Okay, can you explain your role in a patient's care team and how what you provide is different from their therapist or maybe their primary care provider?
Yeah. The role of the psychiatric nurse practitioner is different than your primary care doctor and your therapist. We sort of address a few different things, although we do like to work together, and that is in your best interest. Psychiatric nurse practitioners, we're going to do an in-depth assessment of your psychosocial aspects of your life and some of the emotional aspects where your therapist would be able to sort of dig deeper into the emotional issues and what you're experiencing and what stuff's going on in your life. Your primary care provider, although they can screen for mental health conditions, they don't do an in-depth assessment. We're going to spend some time with you where they typically aren't able to do that.
Think about maybe what your greatest strength is as a provider or something you feel is helpful.
Gotcha. That is info. Okay. I think what makes me a good provider is definitely being passionate about mental health and my personal experiences and struggles as a parent raising a child who has had mental health challenges from early, really early, 3 and 4 years old, all the way up into the he's a young adult now. But I've sort of experienced the aspect of, what it is for a kid to experience these things and the struggles that they go through, the feelings that they have, and also with the parents. I mean, it's hard to have, take care of your child when they're like that and you don't know where to turn. And it's kind of, it's just very difficult. And so I wanted to, with my lived experience of these things, kind of, it's given me knowledge that I think a lot of other providers might not have, to sort of live in the thick of it and know what kids go through and what their parents go through.
You've kind of answered this next question a little bit in different pieces of other answers, but why should someone consider starting maybe their mental health journey at LÉVO?
So, LÉVO is a good place to sort of start your journey in feeling better. We're able to provide, very in-depth assessment when you first come in. It's an hour long, and we'll address, several different aspects of your life and your mental health. And then what we do is sort of we decide as a team, you as the patient and me, and can collaborate with other people on what's best to suit your needs. It doesn't always have to be medication, but if it's appropriate, we can go that route. We can also help you find other resources and services like therapy and support groups, and sort of start a journey and work together and figure out, if we do this, then we'll follow up in a certain amount of time and see how the plan that we sort of came up with is working for you. And if it isn't working for you, we'll work to adjust that plan to continue to try to meet your needs and get you to feel better and be in a better place.
Based on what you shared about your background, anything that you'd want to say to maybe a parent out there who maybe was in similar shoes to you, who's having a child, they don't really know like maybe where to turn or what to do, and they're having some concerns about their child's mental health? If you could speak to that or,
Okay.
share
Yeah,
advice
yeah,
on
yeah.
like to a parent who maybe would be in that spot.
Yeah. So, as a somebody who sort of experienced what it's like to have a child with mental health issues, it's really important, as the parent who I think you can often feel alone, and parents don't, I think, generally talk to each other about what's going on with their kids when it comes to that, because a lot of, I think, those issues are harder to talk about for embarrassment and stigma. And like I said, you kind of feel alone. So I think it's really, really important to take care of, yourselves as parents and, seek out treatment or therapy yourselves or find support groups. I found that, seeing and just even reading, if you join a support group online, reading the experience of other parents makes you feel less alone and less sort of the need to kind of hide from other people and try to protect that information.
It's awesome. The loss is
Definitely.
just kind of more fun. It could be anything unique about you personally or as a provider, anything
Definitely.
you wanna share.
Um, So I'm a little different, I think, than a lot of the other providers here because I'm from Massachusetts. I grew up there. I just moved here about a year ago. So I come with a little bit of a different perspective. The, culture and the atmosphere is definitely different. And I've been told that I have a Boston accent, so you might hear me drop my R's and say I need to park my car. But yeah, oh, well.